This week on Lifeline TV, automated external defibrillators. Salinas Valley Memorial Healthcare System ensuring local schools, businesses, and organizations have them. Tonight, an example of how the device can save a life during a cardiac emergency. Monterey County's first neonatal transport vehicle.
And this is a wonderful service that allows these babies to stay close to the families,
Providing the highest level of care to Salinas Valley Memorial's smallest patients.
A NICU transport service is essentially an intensive care room for neonatal patients on wheels.
An ambulance and team of medical experts able to administer all aspects of critical care on the go. And medical records go digital.
So we were able to pinpoint certain things in the process that before was reams and reams of paper.
Put all their information in, like when their last colonoscopy was, mammogram, pap smear, all their vaccinations, easily looked up in one spot.
Tonight, how electronic medical records improve your health care and contribute to Salinas Valley Memorial Healthcare System's national recognition as one of the safest hospitals in California. It's all tonight on Lifeline TV. Welcome to Lifeline TV. I'm Kate Callaghan. Salinas Valley Memorial Healthcare System's commitment to patient safety is getting national recognition. Recently, 2 national ratings agencies ranked SVMH as one of the safest hospitals in the state.
Well, we're very excited. We think that the third-party validation of our quality and patient safety here is just an exciting thing for our whole staff, our physicians, our community to realize that Salinas Valley Memorial Hospital is in the top of the top when it comes to the most important things for patients and families and visitors, which is patient safety. We're allocating our resources as an organization to ensure that we have the quality. Quality just doesn't happen. Patient safety, you have to be very intentional, very deliberate about moving the organization towards those higher goals. And you do that by how you spend your time and money as an organization. And we have committed to doing that, and the results speak for themselves.
Tonight, we're taking a behind-the-scenes look at what it takes to deliver this high-caliber quality care. Gone are the days of paper record-keeping at Salinas Valley Memorial Hospital. SVMH has invested in moving to electronic medical records, where everything inside the hospital is computerized, including affiliated physician orders, all done online.
Well, we started in conjunction with Salinas Valley Memorial Hospital. We started working on selecting an EMR, electronic medical record, about 5 years ago, and we homed in on one called EMDs. And almost 3 years ago to the day, we piloted that particular EMR system right here in this clinic, Salinas Urgent Care.
And the EMR is now in 126 physicians are using it with 16 different specialties. So from physiatry to podiatry to orthopedic surgery to cardiology, pulmonology, neurology, the primary cares, family practice, all using a common electronic medical record.
SVMH has taken a unique approach in that we've developed a on-site training team and on-site support resources for the physician practices that implement electronic medical records. It can be a very difficult transition. To have that localized support and localized knowledge that can be there in their office in 10 minutes if there's an issue really helps them focus on patient care.
As a patient, I think the biggest concern when you go see your doctor is safety. In the old days you would have a list of medications and you might cross something out and you might write something on top of it or next to it, and it wasn't very clear. But I think with a properly used electronic medical record system, those errors aren't going to happen. Things are going to be easy to understand and the patients are going to be safer.
When you see the patient a second or a third time, or you inherit the patient from another physician in the clinic, you can look back and see legible records. It's much easier to scan through medical history. The data's all there about allergies and medications, past medical history. It's really much superior to handwritten records.
Everybody sort of has that joke that no one can read a doctor's handwriting, and that actually is absolutely true. I mean, I've gotten records from other doctors when patients have switched over to us and specialists where literally I can't read or tell what the doctor's written.
And we can avoid those now by actually writing everything in the electronic medical record in the electronic setting where, you know, it helps your spelling, everyone can read it, you know what dosage it is, you know which pharmacy it went to, you know how many refills there are, and you also then have a list of all the other medications that have been previously just prescribed to the patient.
It also allows you to do some of the important things that everyone's looking at now in terms of what we call population management or integrated disease management, where it enables you to try and catch things before they happen. So you can follow patients. For instance, you can look at your records and see all of your patients with diabetes and sort of pull up a list of, okay, I have 5,000 patients with diabetes. How many of them have not had their flu vaccine, or how many of them have not had their blood tests? So you can proactively contact people to get them in so you can discover problems before they actually appear.
It's put a level of rigor and discipline into the organization as well, because everything is documentable at this point. Everything is traceable. So we were able to pinpoint certain things in the process that before was reams and reams of paper, and able to make improvements.
Which is another thing that we've started measuring very carefully using the new electronic medical record. We can know very precisely when a patient checks in and when a patient checks out, and know what the wait time is for that patient, and then we can start working on figuring out ways to reduce the wait time. And now, very soon, there'll be patient portals where patients will be able to log into a website and get messages from their doctor and see their lab results and schedule appointments and even make payments.
So we're really improving the overall care coordination for, let's just use John Smith, who goes to a primary care doctor, who's then referred to an orthopedic surgeon, who's then referred to a pulmonologist. That information is able and planned to be shared between, and you really need a common electronic medical record, one that all the doctors know that they're comfortable with. And that's what we've been successful with, is using one electronic medical record for multiple specialties and really developing a whole competency within Salinas and the surrounding area for staff, nurses, and doctors to become very proficient.
The system flags high-risk visits and allows doctors and urgent care staff to follow up more proactively. If someone comes into the office who is in pain or really sick, all that information is documented in the emergency medical records, and a care nurse will follow up the next day. In one recent case, that checkup may have saved a life.
We had a patient with headache, an elderly lady who had fallen, and x-rays were normal, a neurologic exam was normal, and it seemed to be not a particularly serious problem. But we went through the usual process of care and gave her some non-sedating pain medication and told the family what to watch for. And then Alana called the next day as a part of follow-up, identifying that had been a head injury, and the patient was having actually increasing pain. She got back to me. My recommendation was at that point to send her to the emergency room. Turned out she had an intracranial bleed, was admitted to the hospital, and had a potentially life-threatening problem. And had she lingered at home, the possibility is that she would have gotten substantially worse, maybe some permanent neurologic injury in the worst setting. Maybe she might not have survived it. So the case management person, Alana, did a really quite good job of identifying that, what to do, and facilitating a patient getting to the emergency room for appropriate care.
Back inside Salinas Valley Memorial Hospital, where patient visits are all digitally documented, from administrative work to tracking medication. In fact, all patient wristbands and medications are barcoded to ensure the right pills, shots, and dosages go where they're supposed to go. Here's how it all works.
She is on potassium, 10 million equivalents twice daily.
Everybody's seeing the same information at the same time. It's not on a piece of paper that is hidden on a chart or somewhere else. So anybody with access to the record on a computer is seeing everything in real time.
Because in the old days, you'd have to actually get the medical record. It would show up an hour later. By that, from our point of view, we're done by that point, you know. And so this was actually real time. I found it very useful.
So you need to have some sort of tracking mechanism that can be tracked straight into the hospital and follow the patient all the way through the system.
We built the sets so that it'd be one-stop shopping for the doctor for the first time they go in there and want to order tests on the patient.
EMR, all your labs pop up. They have different color-coded symbols that you can see right off the bat, so you know when something's missing, when somebody needs to go to x-ray.
The concept is within 1 or 2 clicks, I can order a medication that can be titrated to its effect.
There are a lot of advantages to it in terms of that we all do what we call computer order entry, where we put all the medications in through the computer and then the nurse gives the medications, which the advantages of that is that it reduces error rates. I'm a doctor, so my handwriting is horrible, so it gets rid of all that, which is very, very nice.
Patients have a barcode on their identification bracelet. We take the little EMR gun, which is a little scanner. It lights up and it will actually scan, and it pops up a screen that shows us the medication that are ordered for that patient. It won't allow us to document a medication that's not ordered for the patient, so it checks to make sure that we're giving it to the right patient, the right dose, the right time.
Salinas Valley Memorial continues to be a leader in healthcare technology. Tonight, we're taking you on a tour inside its pharmacy to show you the measures being taken to ensure patient safety.
The implementation of technology that we did along with the move, I think we're probably one of the most state-of-the-art pharmacies in terms of technology. Let's go take a look at our sterile compounding area. We're very proud of this. It fully meets USP 797 federal guidelines for sterile IV compounding in hospitals. Everything in here is sterile. Rooms washed down at least once a day. Floors and the hoods are washed down 3 times a day. And we also go through a complete terminal cleaning process monthly in here, including floors, ceilings, walls, everything else. This is done so our lead pharmacists who sit over in this area basically can see different areas in the pharmacy. They can look into the 2 IV rooms that we were just looking at and provide overall supervision of the techs and see what's going on. They also have a vision of our narcotics storage area, so even though it is pretty much in complete sight in the pharmacy, the lead pharmacist can always look up there and see if anyone's taking narcotics out of the narcotics vault. And then the back area is where our technicians are utilizing our newest technology, the vertical carousels. So what Bruce is doing with that, he's pulled the medication, scanned the label, it says this is the medication that you need. The carousel's turning it to the correct position. It's indicating on the light bar which bin it's in. And then when he pulls the medication out of it, he's barcoding it to verify that he's actually got the right medication in that bin. So we do the same process when we're loading medications into the carousels as we do when we're pulling them out, to making sure it's the right drug going in and the right drug coming out. This is our AutoCrack, which is a unit dose packaging machine, and it allows us to take bulk medications and put them in a unit dose form with barcode on them. So basically a pharmacist checks the medication that's going into the machine and barcodes it to make sure we've got the right medication in the right canister, and it checks that going in, and it's got the lot numbers, expiration date, the manufacturer's name on it, as well as a barcode. And this barcode is scanned by the nurse before she's giving this drug to the patient, along with scanning the patient's barcode. So we make sure that we're giving the right drug to the right patient at the right time. These are our autocols, which are carousel technology for refrigerated products. They allow us to store refrigerated products a lot more efficiently than in the past. One of these autocols basically replaces a double-wide refrigerator, so we've definitely been more efficient with space by doing this. It also allows us to track expiration dates and quantities much better than we could in just an open refrigerator, which we had done in the past. So basically when the medication is picked on the computer, it opens only the door for that particular medication. And again, there's only one medication kept in here, and we would end up using this barcode to make sure that we've picked the right medication before we close the door. This is our narcotics storage area. All our controlled substances are stored in these narcotics vaults. Everything on here is computer controlled. It's all password and user ID access, so we can track every transaction that goes on, anything being received into the controlled substance vault. and anything being removed, who's done it, what time, etc. It also says, lets us close the loop when we're taking controlled substances to a certain nursing unit. It communicates back to the vault to make sure that those controlled substances actually got there. And we run reports every day to make sure that we haven't lost any medications or haven't miscounted medications.
With funding from Children's Miracle Network, Salinas Valley Memorial has an exciting addition to its neonatal intensive care unit. The first ambulance of its kind in Monterey County, exclusively for transporting the most critical infants or expectant mothers. The ambulance is fully equipped with an incubator, ventilator, and transport team, ensuring quality care from a patient's door to the NICU.
A NICU transport service is essentially an intensive care room for neonatal patients on wheels. And that is something that is really important in a community where there are sufficient births every year that would require an intensive care approach for their treatment plan.
This ambulance was purchased through the generosity of the SVMH Medical Foundation and Children's Miracle Network. It has wonderful room to fit our transport team and a transport incubator and ventilator.
This is so important for the people in our community and again the surrounding counties because now they know this high level of care is available right here in Salinas. Right now, these infants may have to travel an hour and a half, 2 hours away, and that is such a difficult time for parents and family members, not only when an infant is sick, but then to have to be so far from home. That travel just adds a toll to all their worries and the stress that they're already going through. But to know that that baby can be right here in the center of Monterey County, being cared for at Salinas Valley Memorial Hospital, that is a real benefit for them.
We have found that over hundreds of babies each year are either born out of Monterey County or are transported out of Monterey County. And a large percentage of those babies can actually stay in Monterey County to receive services. Now that we are a community NICU, many of those babies can receive the same services that are available in the Bay Area with the same type of expertise, the same type of neonatal physicians and neonatal nurses and respiratory therapists. And this is a wonderful service that allows these babies to stay close to the families.
The neonatologist will be the first one to gather the information about the infant and determine that yes, this is an appropriate transport. Sometimes the neonatologist may even accompany us based on what the anticipated needs are for the infant. The core team, though, consists of a NICU nurse who is qualified for transport services, and then our NICU respiratory therapist. Again, this is qualified staff who are really trained and skilled to care for this special population, our little patients.
The ambulance itself is equipped with oxygen and air to regulate the type of ventilatory service a baby may require in the immediate newborn period. It also has all the equipment that we use in the NICU in terms of many of the suctioning equipment, the ancillary supplies. It's interesting when we pick up babies that often weigh 2 or 3 pounds, the equipment itself weighs several hundred pounds and is fairly large. And it requires an ambulance of this size to take not only the equipment but also the team. So this ambulance has everything we need on wheels, and we're so excited that we have this and we're utilizing this.
If you'd like to help provide kids wonderful opportunities like the ones you've seen highlighted so far, please make a donation to Salinas Valley Memorial's Children's Miracle Network. All of the money raised tonight will stay local and directly benefit Central Coast children. Here's how to pledge your support. It's easy. Just log on to our website, svmh.com/CMN. On behalf of the Children's Miracle Network, we thank you. When it comes to natural beauty, the Monterey Bay is about as amazing as it gets. And this summer, Children's Miracle Network and the Monterey Bay Aquarium partnered for a very healthy adventure called Days of Discovery. This event allows kids with special needs to connect with the ocean in a whole new way.
We call this the best day of the year, the Zach Brunel Day of Discovery, sponsored by Children's Miracle Network. It's the best day of the year. This is the 11th year we've been doing it. So able-bodied, disabled kids, we're all equal in the water, and it's a freeing experience for all of us.
And we got into the water, we met Sadie, and she's a complete quadriplegic, and just being able to take her in the water, get her in there and under her face in the water with a complete mask, it seemed like a really great experience for her, and we were just amazed by it.
She loves the divers that are with her. You know, she's a big flirt, so she loves that part of it. But she really, you know, when you're watching her, she keeps doing the thumbs up, and that's her way of telling people, yes, I still like it, I still want to be in here.
And she does require assistance, obviously, but she can just float there and be weightless, and, you know, I think she just kind of moves through the water gracefully. I think it must be a completely different experience for her.
We have all sorts of resident monkey face eels, perch, a couple rockfish, gunnel eels, all sorts of invertebrate. The tide pool's full of life.
This is great. This is amazing for her. You know, this is her last year because she ages out at 14. And so now we're looking for a new adventure for her because this has been so good for her. So good. And as a parent, you just want your kid to be able to do as much as they're able to, especially when they have such limited capacity for, you know, physically. So this is fantastic.
We do this 3 times a year, and we hope to continue this for years and years to come with all the support of the community and with the support of great organizations like Children's Miracle Network.
In an emergency, seconds count. That's why Salinas Valley Memorial has distributed automated external defibrillators to local schools, businesses, and organizations, so they'll be readily prepared for a cardiac emergency. And for one local man, it saved his life.
Just a routine visit to go over the lab work I had done the week before, because it just, boom, it happened right. Just sitting like this, but up on the table. And the next thing I know, I'm on a gurney with a whole bunch of people looking down at you.
He was in this room. The door was closed, and so we just heard the thud from the other side of the room. And then we came in and rushed in, and he was lying on the floor here. He was face down. I kind of shook him, asked him to wake up. He didn't wake up. Turned him over and checked his pulse, and he had no pulse. I called for help and then started CPR because he was actually literally dead.
And I was sitting at my desk and I heard Dr. Clark yelling for help, so I ran over here to see him. And he was in this room, and then that's when I said, I'll go get the AED.
Chanelle came with the AED, and she was great. We didn't have to do anything. She just kind of, took the shirt off, put the paddles on, got everything set up, pushed the button to start it to go. As soon as the machine told us, to, stop CPR, we stopped CPR. It recommended a shock. It shocked him. He started to wake up.
If I'd have been there on the job and this had happened, I don't think just plain CPR would have done it. Yeah, it took a little while, Then it settled in, and you would have been dead.
When somebody goes into sudden cardiac arrest, they only have 4 to 6 minutes before their brain starts to die, before the lack of oxygen causes brain death. So our goal for the HeartSave program is to get defibrillation available within that 4 to 6 minute window to every resident and visitor in Monterey County.
I just want to encourage people to get the training, to know how to use this kind of equipment, because it could happen anywhere. I'd love to see the day when an AED becomes standard equipment in the back of your car along with your car jack, or we all have one in our homes, because you never know where you're going to be when an event like this occurs.
And it felt really good to shake his hand, and the first time I saw him after that, I gave him a hug because he's here talking and we helped save him, and it felt really good to see him and actually see that he was doing good.
Recently, wedding bells rang at Salinas Valley Memorial. When a hospital stay nearly postponed a couple's walk down the aisle, SVMH employees stepped in and ensured they'd have their special day.
Please everybody be seated. Good afternoon, ladies and gentlemen. I'd like to welcome you to the marriage ceremony of Jose and Karla. I'd like to welcome all family and friends to be here. This is a very special day for the two of them.
The hospital actually offered us the help because my mother-in-law is here at the hospital, and the nurses saw how overwhelmed we were after the news, what they told us, and I guess they planned it without me knowing, because I was just like, I was in the middle of canceling my wedding because of my mother-in-law was here, and I didn't find it fair for us to get married and have like a big party when she was in here. So the nurses planned it and decorated and got us the judge, and and made it happen for us to have my mother-in-law present.
Karla, will you take Jose to be your lawful husband, to love, comfort, honor, and keep him in sickness and in health, in richness or poverty, for better or worse, until death do you part?
Yes, I do. Okay. I was just so overwhelmed of seeing people here, but I love it. It's really nice of them actually to help us and make our dream come true with our family here as well. My mother, my brother, all his brothers and sisters, and it's just something we didn't expect, but we're really thankful for.
With this ring, I thee wed, and I promise thee my faithfulness. By the power vested in me in the state of California, I declare you husband and wife. You may kiss your bride. And if you turn around, please, and face the crowd. Ladies and gentlemen, I have for the very first time the pleasure of presenting Mr. and Mrs. Jose Lucas.
That's it for this edition of Lifeline TV. Thanks so much for joining us. For more on any of these stories or any information on Salinas Valley Memorial Healthcare System, log on to svmh.com. We'll see you next week on Lifeline TV.